Today is a very important day in the course of the pandemic in Australia. We see over here the first wave, the second wave, which was overwhelmingly, of course, within Victoria, and then the outcome from the twin outbreaks in New South Wales and Victoria. Today's Australian numbers are 0 cases in the community in 7 out of 8 states and territories. 1 in Queensland, and we have full confidence in their ability to track and trace, but 0 cases in each of New South Wales and Victoria in the community. 1 expected tomorrow in New South Wales, but 0 today. And it's important to remember there was a prediction, for example, of 3,000 cases in New South Wales on the 8th of January, made only 2 weeks ago. And today, 0. What that means is that the outbreak and containment structures that have been developed prior to the pandemic but enhanced during the course of the pandemic are succeeding, are protecting Australians, are saving Australian lives. Equally, it's important to understand there are now over 11.75 million tests that have been done for COVID in Australia, and only yesterday over 100,000 tests conducted in Australia, with later figures to come for the day. If I could have the second slide, please. Then we look at Australia in comparison with the world, and we see here that there are a group of countries that, highly advanced, developed countries that are living in the most difficult of circumstances. 87 million cases, over 1.88 million lives lost officially, and no doubt higher for those that were never diagnosed. In particular, today, it's likely that the world will see over 750,000 cases, over 13,500 lives lost. In the UK alone, a country with which we're so close, over 62,000 cases and 1,000 lives lost, and in the United States over 240,000 cases and 3,700 lives lost. Unimaginable numbers and agony that those communities are facing. We have been fortunate through preparation and planning and the good work of Australians and our health officials and governments across Australia, all of the work of all of the Australians, that we are in a group here with Japan and Korea slightly above now, Australia, New Zealand. We know that the jurisdiction of Taiwan has also done very well. And that has framed how we approach vaccination in Australia, and it's a very important part of it. Those countries which are here are working to an expedited but full safety assessment. Others in the grip of extremists in the dark of a northern winter are having to make the most difficult decisions around emergency vaccination, which we recognise and support and acknowledge, and given the circumstances, that's completely justifiable. I would note that as part of our response, just to give a brief update, with regards to aged care, asymptomatic testing, 67 facilities recently completed in New South Wales, no positive cases. Victoria, 256 facilities at the Commonwealth's request tested, no positive cases, all negative so far. So that then brings me to the third slide and the strategy. In particular, and I'll let Professor Murphy and Kelly speak to the bulk of this, there are 4 principles to what we're doing. As the Prime Minister said, safety first above all else. Secondly, safety is about confidence, and vaccine confidence leads to high take-up. There have been parts of the world that have had challenges with vaccine take-up, even though they are in the grip of the most extreme phase of the pandemic. So confidence about safety is fundamental to Australians. Thirdly, swift but safe, and fourthly, under-promise but over-deliver. We've continuously exceeded our targets, and that's what we'll strive to do. So in terms of the priority groups, and this is something that's been determined by the medical experts, You will see the phases 1 and 2. There's no surprises, as the Prime Minister said. In phase 1A, quarantine and border workers, frontline healthcare groups, aged care and disability staff and residents, and that's been foreshadowed. And Brendan will take you through the other elements. Also, though, within our strategy, a very important thing is that they have separated on medical advice the cold chain and the non-cold chain distribution processes. So there will be a series of hubs for the cold chain, so there is no risk of confusion about vaccines or risk to the process. These 30 to 50 hubs will provide early support across those 3 groups. And then for the AstraZeneca vaccine and in turn, in time if required for the Novavax vaccine, over 1,000 locations around Australia. So over 1,000 points of presence working in conjunction with the states for vaccine distribution.